If you have a heart attack, you want to know you're getting the best, most effective treatment as quickly as possible. A STEMI is a serious type of heart attack in which a blood vessel in the heart is blocked. NCH Healthcare System has been working hard to cut down the time between when a patient gets to the hospital with a STEMI to being treated. And in today's Your Healthy Family, I'm showing you how, over 3 months, they've been able to cut that time in more than half. It starts with a 911 call.
911, what is your emergency?
Normally people call with chest pain. The dispatchers have a set list of questions that they follow that kind of relay information to us through our CAD system. We're getting that all in real time.
Flight medics Lieutenant Andrew Stager and Lieutenant Christine Credo say that's how Collier EMS will get information about the STEMI patient's symptoms and history.
That's when we're already starting our treatment evaluation in our head, what we're going to do, where they're going to go, how fast we're going to go.
Within 6 to 8 minutes, they're on scene.
We start with a lot of these STEMIs, the treatment, the medications, oxygen, before you get to the hospital. When we show up, we have a slew of medications, interventions, knowledge and experience that happens right there.
Including an EKG to determine if the patient is having a STEMI or not.
They'll send us a copy of the EKG and give us a heads up they're coming in with a STEMI.
Which emergency department Dr. John Zelahay says gives them time to get ready.
We have a charge nurse that basically calls the STEMI alert.
That notifies the cardiology team of what's coming.
We immediately deploy the team that's going to take that patient to the lab and open up the artery effectively.
We can mobilize everybody in the emergency department, and we can have the ER techs, ER secretaries, nurses, everybody on board for when that patient hits the door.
When the patient shows up in the ER,
they get another IV and an EKG, some blood work all drawn in probably less than 2 minutes.
All of that happens in less than 2 minutes.
It's like a pit stop.
He says the patient is then handed off to the interventional cardiologist.
We as cardiologists come in, we access the femoral artery or the radial artery, we cannulate the artery and make it up into the heart with a catheter, and then we negotiate wires and balloons to open up the artery.
So through an artery in the leg or the arm, a catheter takes a balloon to the artery to open up the blockage.
At that point, heart's contracting well, the muscle is getting oxygen, and most patients recover quickly and they're discharged home within 24 to 36 hours.
The NCH Healthcare System team, from the ER to the cath lab, has worked with Collier EMS to cut down the door to balloon time, or the time from when the patient comes through the ER doors to the balloon relieving the artery's blockage, to just 28 minutes.
Putting us at the 99th percentile in performance.
And putting NCH well above the national guideline of 90 minutes, when minutes matter most.
Every minute that you save will translate to improved survival. We want our patients to come to NCH if they're having a heart attack because we know we can take care of it immediately.
Now, Dr. Cubedo says they knew they owed it to Southwest Florida to provide the best level of care. Something that was key in being able to make this major improvement was the NCH Healthcare System Simulation Center. They were able to run through real-life scenarios and adjust their protocol accordingly. I'm Lisa Greenberg, and that part of the story is coming up in tomorrow's Your Healthy Family.